You cannot underestimate the power of this medicine, people, okay? And these are so simple that I know some of you are going to be going, oh God, that's right. That's so simple. But are you doing them? Are you doing them? This is stuff that we need to be doing every single day, because we will rewire our brains for experiencing more positivity and more joy. And this is a cascading positive effect towards more vitality and more energy. Why is chronic fatigue syndrome so misunderstood, misdiagnosed, and mistreated? I've been really thinking about this for a long time, because it's been in my life for so long, and I've worked with so many patients with this, and I've heard stories of patients who come to me, and they've been to so many doctors who have said, I'm sorry, we just don't have any answers for you, or you just need to drink some more coffee. Patients that are sent to the psych ward instead of given any effective treatments, they're given antidepressants or hormones. And it's just like, why? Why is there not a better understanding? And I kind of get it. I understand why. I really think it's because this old model of medicine that we need to change has been so fixated on finding the one thing that causes chronic fatigue syndrome. We want to know what the one thing that causes it, so we can test it, and then we can find a drug that treats it. And this works for some illnesses and conditions, but it doesn't work for this one. Yet it's taken the whole medical community a very, 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 very long time to give that up. I am happy to say that it feels like that's beginning to happen, but it's not totally understood, which is why I'm standing here in my soapbox and talking about it today, because I still am hearing every single day these stories of doctors who are not getting it, and patients who feel misunderstood and mistreated by this. When I first was trying to get out of bed and I was researching this, all the research really was looking for the one thing. They're saying, oh, it's all Epstein-Barr virus. Oh no, it's all parvovirus. Oh no, it's all mitochondria. Oh no, it's all your hypothalamic pituitary axis. But they would say, I wonder if there's a genetic marker that everybody has who has chronic fatigue syndrome. Every single time that the researchers went out and tried to run a test to prove this, they kept coming up with no, 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 no. I felt personally revolutionary in my thinking when I realized that this was a multifactorial condition, that there was more than one cause, because what I was seeing in clinic and what I was experiencing in my own body was so different from what was out there in the literature. Now, what I have to say, and I'm excited to say, is that recently, like in the last 2 years, now those who are on the forefront of research for chronic fatigue syndrome are agreeing with me. They agree that this is multifactorial, that there are multiple root causes, and that they can interact with each other. And I am frankly glad. This feels like that what I'm talking about is a place that we are naturally going to be going to, just like it was time that we had a light bulb and multiple people figured it out at the same time. So I am good with that, because I want the most people as possible to experience better health and more vitality. To this day, just to be clear, we don't have a single clear diagnosis or cause of chronic fatigue syndrome, and no clear test, and therefore no clear treatment. Chronic fatigue syndrome, like I said, it can make somebody so ill they're in bed or in a wheelchair, and they're clearly so ill, it can confound a physician. I mean, it's hard as a doctor to have somebody who's clearly so sick and you're clueless with how to help them. And other patients can feel like, excuse the word, crap, and look so good. I mean, they just look so good. I have patients that sit across my table and they look amazing and they feel horrible. And they walk down the street and people are like, oh, I wish I had her life. She looks pretty good. And they don't have a life that people envy. If a doctor pulls a standard lab panel on those patients that look great, that are sitting in their office, the labs can all be normal. This makes it really, really hard for a lot of doctors, because they feel really unsure and insecure with a diagnosis just on history if they don't have it confirmed by a test. It's just how we're trained. You know, we're trained to take a history, to run some tests, to have it be part of the standard medical association approved list, and to just kind of do our little marching orders. I'm fortunate that my degree is different, and my thinking, my ability to think, has been outside of the box the whole time, which I think is why it's easier for me to be comfortable with some of what I'm going to be entertaining in a few minutes for you guys. It's super frustrating as a doctor to not know what to do, and as humans, we're human, and we often push away that we don't understand, which unfortunately means that too many chronic fatigue patients feel left, just left out. They feel pushed out the door, and they feel, placated or disbelieved. I sure had that. I likely had chronic fatigue syndrome when I was a teenager. I was in high school, and I asked my dad to take me to the doctor because I was so tired. And this Kaiser doc, he ran a few labs on me, and he sat me down and he said, "You don't have mono, and your strep test is negative. Go back to school and stop trying to skip out." And, he clearly just thought I was, a great Scottish word, skiving. He just thought I was skiving, I was skipping school. I was pretending to be sick so I could go talk to him. I can tell you, if I was going to skip school, I was going to do something more fun than talk to him. This is really why we need to get more, it really did not make me feel good as a teenager. And this is happening all around the world, where too many people are getting dismissed. They're being told, "You don't know your body as well as I do. My test knows you better than you know your body." And that's wrong. That's part of the thinking that has got to change for both the physician and the practitioner. The patient needs to take on the role of owning their own health and being willing to not expect the doctor to fix everything for them, and be willing to own their own power to heal and work with the physician to be able to help guide them. And the physician needs to be willing to be the guide in some territory that is not totally charted, and be willing to respect the patient's wisdom of what is happening with their body at this time. Healing from chronic fatigue is not a straight line where you're here and then you go straight up. It's a bumpy road like this. And we all need to have patience and guidance in the process. This condition is complex, and meaning it can be caused by more than one thing. So what I'm going to share with you what I discovered, because it's been so helpful for me in my recovery, for my patients, and for the doctors that I have taught this to. I was able to teach a whole group of physicians how to use this diagnostic formula so that they can help their patients better. There are 5 potential root causes of chronic fatigue syndrome, and a patient may have 1, 3, or all 5 of them. And they can be interrelated. So it's easy to think, oh, it's just one thing, but they kind of, they're interrelated because our bodies are interrelated. We are complex beings, which is why illness lands in us in a complex way. So I'm going to go through the 5, and then I'm going to go back and go in a little bit more detail for you guys, okay? So the 5 root causes: chronic infection, hormone imbalance, mitochondrial dysfunction, toxic exposure, or unresolved mental emotional issues, or limbic dysfunction. So that can be grief or anger or something like that. So let's go back. So chronic infections. So the trick here, and this is hard for physicians to hear, I know, and it's hard for some patients, but here's the deal. You can have a chronic infection in your body that rises and decreases depending on what's happening in your body. It can be different times of your menstrual cycle, it can be different times of the year, it can be different times of your stress, and it can rise and fall and rise and fall. That thing that's in you may not even have a name, let alone a test. There's a lot of viruses that we don't have names for. There are other critters. We don't have names for all of them, let alone good tests for them. So as physicians and patients, we have to get comfortable with being willing to treat something that doesn't have a good test. We have to be willing to become excellent practitioners and excellent owners of our own body, and begin to understand what we're feeling and thinking and what we're saying. I know what it feels like in my body if my virus is increasing, and so do my patients. They're extremely well educated, and they'll call me and they say, I think I'm having a flare. I'm like, okay, do you know what to do? I think so. I think I'm going to do this, this, and this. I'm like, sounds great. Call me if it doesn't clear up in the next few days. Well-trained patient. And the viruses can hang out in the brain, in the nervous system, in the joints. They can go in the organs. They can be in the thyroid. They can go to lots of different places. So they can be really kind of wreak havoc with us. The next one is hormonal imbalance and hormonal imbalance. And this can be the hypothalamic pituitary axis. It's often called adrenal fatigue. You can have a thyroid imbalance, or it can be the ovarian gonad imbalance. These all work together like a symphony. And if one is out of balance, then the other one pulls out of balance as well. And it can be, you really want to have them all working together. And it's so nice when they do. You feel so much better when they do. It's very common for patients to have something with their hypothalamic pituitary axis. I would say that most patients with chronic fatigue have some aspect of some HPA imbalance. The reason is that this is our stress response, and we're just like kind of a stress-crazed world right now. You know, when I was in the 90s, when we were first treating chronic fatigue syndrome, I thought it was all HPA imbalance. I mean, we thought that we had figured out that chronic fatigue was due to adrenal fatigue, something we called adrenal fatigue. And a lot of people got a lot better with that. And for some, that's all they need. They just need support with their adrenal glands, and they're fine. They're good to go. But many, many people need more than this. And this is one of the things that when I got the chronic fatigue the second time, man, I was taking all kinds of adrenal stuff, and it wasn't enough. I had to go deeper in to figure out what it was that really I needed to do in order to heal. The third root cause is mitochondrial dysfunction. So mitochondria are these super cool little things. I love to geek out on them. I have a great talk on mitochondria. I'm not going to go into it, although I love them. They are the powerhouses in all of our cells. If we were to lose our mitochondria like that, we would die in 3 seconds. They're just a little bit important. And this is, it is the mitochondrial dysfunction which leads to one of the hallmarks of chronic fatigue syndrome, which is post-exertional malaise, being tired after exercise. That feeling of, oh, I'm going to hike a little bit longer, or I'm going to go to the grocery store and the bank. And then you're exhausted, or you're like, oh, I have so much energy today. I'm going to wash the dishes and put on a load of laundry. Oh, no, I'm stuck in bed for 4 days. I know some of you get what I'm talking about. I have been there too. So that is mitochondrial dysfunction for most people who experience that. You can have a genetic disorder that leads to mitochondrial dysfunction. Most of the people that I see who have mitochondrial dysfunction, it's not a genetic disorder, but it looks like it. And this is because there are infections and toxins that have gotten into the mitochondria that are altering the way it functions, and so it can't function efficiently. And so it makes people not be able to get all the energy that they need in their cells, and they're tired. I love being able to treat this for patients because we get such huge results in a short period of time. If their mitochondria are dysfunctioning, and that is what their body is ready to heal next, then we know in 5 days if the treatment's going to work. There are tests for this. This is, you can do an organic acid test, which is an indirect test of mitochondrial function. But I just honestly do a history. I do a really good history with people, which I teach in my course, of how to tell if you are experiencing mitochondrial dysfunction. And then we just do a trial of some natural remedies and see if it makes a difference. If it does, that's great. I want to just pop back and say, because I realized I forgot to say, for the hormonal imbalance, you can assess that by somebody's history, but there are some great labs in the functional medicine world that are great. You want to do a full thyroid panel. You can do an adrenal stress test. It's a salivary cortisol test. And that will really help you assess where somebody is at with their hormone imbalance. Okay, so number 4, toxic exposure. Who doesn't have toxic exposures on this planet? I mean, unfortunately, we have dug up the inside of the earth and put it on the outside and built it up, and some of it was just kind of better buried, you know? And we've made some really cool things like plastic that are really bad for our bodies. So, you know, we kind of live in a little toxic nest. I say the gift is that we can be detoxing every single day and get those toxins out. So instead of being freaked out about it, we do our best to make our best decisions and best choices to stay as healthy as we can. And then we detox every single day. Toxins get into just kind of like other things. They land in the joints and the fat, and it's very hard to tell what somebody's overall body burden is for their toxicity level. What I generally look for are heavy metals and mycotoxins, because I find those are the easiest to assess and the most powerful ones to get rid of. Are there other toxins you can test for? Absolutely. People spend thousands of dollars looking for tests, hunting down for various toxic exposures, and it's just sort of where I've chosen to land as a clinician, where it hasn't seemed to be that valuable for me. I'd rather people just started to detoxify, because I figure they're all going to come out. Once you start doing saunas and skin brushing and eating great diet and lots of green food, it's going to start coming out anyway. The fifth and final root of chronic fatigue syndrome is the emotional one. I always knew there was an emotional root to chronic fatigue syndrome. You know, when I was so ill the first time, healing my subconscious mind was huge. I mean, that is why I mean, as long as it took me, I actually got out of bed relatively quickly, because, and I got into a better mood. I got my anxiety and my depression handled very well, very quickly, because I did subconscious work. There was no doubt in my mind that there was a huge aspect to the mental emotional piece. And this is where I was super resistant to doing more work. This is that fifth root cause where I actually knew a whole year before I delved into this that it was out there and that I might need it. A whole year. I wasted a year. And I was like, no, I don't want to go there. I don't want to go there. I did all the doctor things. I thought, I'm so good at helping people with their subconscious beliefs. I do this in my practice. I do it so much on myself. I've spent so much time working on it. Surely I can figure this out all by myself. Why would I need to go get somebody else to help me with this? And oh, I was so wrong. So I did a great course, and it really helped me heal my limbic brain. And that training has really allowed me to just keep expanding my world. And it still gets triggered sometimes, especially with this whole pandemic thing. But it's great because I have the tools and I know how to shift my mind back into state so I can continue to feel as live as I want to be feeling. Because there are all these multiple root causes that all have real validity and can impact somebody in terms of helping them get better, I think it's why the literature was so confusing for so long. And people were really holding on to their corner and saying, no, I'm sure it's a virus. I'm sure it is. Because so many people got better with the virus, with the antivirals. Or other people saying, no, I'm sure it's mitochondrial dysfunction, because so many more people get better when you do these things. I just think we can say yes, and yes. It's all of these things. But what I will say is that I am able, and this is something that is totally within the realm of possibility for you, no matter if you're a physician or if you're somebody who has fatigue, as you get to understand these deeper, these 5 root causes deeper, you can very easily begin to map out and realize which one is up for you. And which one are you at risk for? Which one is up for you? Or if it's gotten better, which one are you at risk for being reactivated with? And once you know how to treat it the first time, you know how to prevent your reactivation. You just have to have the tools in your kit and apply them as necessary. When my dad was dying, the chronic infections get reactivated with stress really easily. And when my dad was passing, I knew I was at risk for having my Epstein-Barr virus come back. So I started increasing my dose of my herbs just so that I could keep that level down. You know, this is just an ongoing process. Again, that journey to healing is not just straight up and done. It's a continual process, and it's true for everybody. And I'm just going to share this with you because I really have found this to be super cool and true. The very same things that allow people who are chronically ill from chronic infections like chronic fatigue and fibromyalgia, the very things you have to dial in, this making sure you don't have any infections. I didn't even go into some of the other stuff, but I do in more detail in my programs. And hormone imbalance, having your mitochondria top notch, you know, limiting your toxic exposure, make sure you're detoxifying, your digestion is good. working with your mental, your mindset. Do you know what this is not just about getting well so that you can have a quote unquote normal life? These very same exact things are what we need to be optimal performers, to be able to do our best, to be able to push ourselves. So I use these tools if I feel like I want to really push myself to do something cool. If I want to go on an extra big hike, if I want to work on a work project, if I want to push myself, I know that I can, and I use some of these to support myself. And I also know that I have my limits, and there are places where I can't. Just saying, there's a whole other world available to all of us. It takes time to get this kind of history from patients. And doctors, this is where the challenge is for physicians. In a world where their ability to be with their patient is being squeezed away from them by insurance companies, the doctors need to take a stand and be willing to be with their patients so that they can get a full history. And patients need to be willing to know enough about what's going on with their body to advocate for their own health in a positive way, not from that victim anger state, but from a positive co-creation types of ways. And the other thing that's really common as something that makes it easier for us to get chronic fatigue is ongoing stress, which we all have. Emotional stress impacts our body in multiple ways. It affects our cortisol levels, it affects our autonomic nervous system, and it creates this thing where it blocks optimal digestion, detoxification, so we don't get our nutrients. It makes our immune system not work as well. And it can stimulate your brain to start focusing on all the things that are bad in your life and all the things that are scary and kind of trigger that limbic dysfunction. So it can become a vicious cycle super, super, super fast. I'm hearing and seeing so many more people who are just feeling more tired right now. And a lot of this is from just the emotional stress that we're under. We're all grieving. We are. We're grieving the life that we don't have. And we're grieving the fact that we don't know what our life is going to be. You know, we're not sure what we can look forward to. And I really think that there are so many things that we can be doing every single day to shift this. We can still honor what's real for us, and we can shift it so that we're not experiencing it in such a stressful way, so that our immune systems and our digestion and our detoxification can still function optimally. And we can move ourselves further and further away from the risk of having chronic fatigue syndrome. We should be doing these every single day, maybe even hourly. Okay, so here's the deal. 3 things. You got to acknowledge what you're feeling. How are you feeling? Fearful? Angry? What is it? And then you can choose change. Now, if you're feeling angry and you just want to process that anger by feeling it, that's fine. But you don't need to live there for longer than you need to. So number 2 is choose change. And number 3 is pick a tool to shift that for you. Here's a few options. Gratitude. I know everybody talks about gratitude because it works so well. That's why we talk about it. If we shift to a state of gratitude, we cannot still be in the state of anxiety. One of my quick tricks is just to scan a room and I just land on something. There's a beautiful orchid. You guys can't see, it's right here. I can see that beautiful orchid and I can say, oh my gosh, look at the light coming through the flower. That is so beautiful. And I can focus on that beauty and it can shift my physiology. You're literally lowering the inflammation in your body when you do this. You're literally rewiring your brain for the positive. You can also use an essential oil, which really quickly goes to the limbic brain and shifts you into a different mental state. You can move it out. We love moving in our house. I love to dance it out. If you're angry, moving your shoulders works really well. My husband does this great thing when he's feeling anything. He jumps and he's so cute. He just stands and he just bounces. He does like the pogo jumps in the kitchen. And here's the great cascading effect of this. Okay, so my husband, it's 8 o'clock in the morning. We're trying to get out of the house. My husband starts jumping in the kitchen. And he's jumping and he's so dang cute that I start to just smile and you know, I'm starting to giggle. And then our kid walks in and he sees me giggling affectionately at his super cute dad who's jumping like a little pogo stick. And that sets the tone for our day. You know, just that right there. So I really encourage you guys to just do this. And I know it sounds crazy. And if you're stuck in a bad mood, it's like, I want to stay grumpy. I want to stay this. But don't. Try to shift out as much as you can. Art is another great way. I used to draw mandalas when I was very sick the first time and I was in bed. Art is so healing. It takes us to a whole other part in our brain. So the thing is, find the thing that you can do every single day that really brings you into that place of calm and joy, whatever it is. If it's lying on your back and watching the clouds, do that thing. Every single day, you've got to do something that brings you joy to reset. And then you have to check in and remind yourself to do that throughout the day. And bring yourself back to center, back to center, back to center. Have that be normal and have the stress be the thing that's unusual for you. This is going to help your immune system more than anything. So for chronic fatigue syndrome, we've got to start looking at this in a whole different way. It does not need to be misunderstood anymore, misdiagnosed, or mistreated. Physicians and patients alike can begin to look at this and understand it's a complex condition. And we need, by looking at the 5 root causes, we can begin to see how it is that we can start building towards health. Once you start working on one root cause, it affects the other and becomes a chain reaction of getting more and more vital as you go. It's an amazing thing to experience. We all need to challenge ourselves to continue to be willing to think outside of our paradigms and continue to learn and grow all the time. We all have the ability to shine our light and be healthier at this time, and it's just a calling that we all have, I believe, at this time. Is adrenal fatigue an aspect of chronic fatigue? If so, what is the relationship? Yes, adrenal fatigue is. So adrenal fatigue is a term that has been it's getting used less and less. There's this big research paper that says adrenal fatigue does not exist. So the reason I didn't talk a lot about adrenal fatigue is that the more proper nomenclature for it now in medicine is called HPA, or hypothalamic pituitary axis. It's a super long term and it's so much easier to say adrenal fatigue. But yes, so adrenal fatigue is a huge part of having chronic fatigue syndrome. It is when people's adrenals or HPA imbalance, people can have either too much cortisol or not enough cortisol, and they basically have an altered stress response. And that altered stress response is exactly what can trigger all of the other pieces of your body just not functioning optimally, and can be a very significant piece of the downward slide into having chronic fatigue syndrome. And I would say that some people, the only root cause they have is adrenal fatigue. And once we heal their adrenals, they're fine. Like that's all that needs to happen. If you would like to have more information about healing chronic fatigue, and if you would like to have referrals to other resources, just reach out to me. I'm very happy to help you in any way. Thank you so much for being here. I just wish you the most healthy and vital day possible.